When Ebola hit the eastern part of the DRC in 2019, aid workers, many from the World Health Organization, were supposed to be saving lives. But reports have emerged that some allegedly offered jobs in exchange for sex, exploiting women who needed work. Over 70 women accused the humanitarians of sexual exploitation, sexual assault, and even rape. DW's East Africa correspondent Mariel Muller sent us this report about new cases that have emerged from the city of Butembo. The two women whose accounts we're about to hear did not want to be fully identified.
Desange has to be mother to those her sister left behind. She blames a WHO doctor for her sister Pendesa's death.
That doctor promised my sister a job, saying that they would be working together. And that is when my sister Pendesa got pregnant, even before she started working. With that, the problem began. He turned his phone off.
Pendesa needed to hide her situation from her husband, who was working away from home. She decided to have an abortion. That's risky in DRC. And things went wrong.
She went to the hospital. At that time, we could not accompany her because of Ebola. When she got there, she did not even spend the night. They didn't treat her and she was taken to the Ebola camp.
The doctors assumed her bleeding was Ebola, not a botched abortion. She died that night and was buried like an Ebola victim, isolated from her family. Her husband never returned. Desange struggles to provide for the 3 children. She blames the WHO worker who abandoned her sister.
He should be arrested.
This woman's story is similar, but she survived. We'll call her Masika.
He told me he was a doctor working for the Ebola response team.
She had 3 children and no job, so she took his offer of work as a cleaner in exchange for sex. But he got her pregnant and pressured her to have an abortion.
I got the abortion because it was a difficult situation in my life. He told me I did not come here to build a family, but to work. For me, it was a situation of life and death.
The doctor blocked her calls. Her family threw her out. Now she's rebuilding her life alone. This group is breaking a taboo by talking about how contacts between aid workers and local women can end. They say it's sexual exploitation, an abuse of wealth and power.
Now, a woman knows that a humanitarian is not allowed to abuse her. She has a helpline she can call. If the person is not punished, the woman can be psychologically troubled and can't return to her normal life.
The WHO has launched an investigation into media reports of dozens of exploitative relationships between its staff and local women. It said it could not talk with us until the investigation is complete. Desange says her whole family was betrayed by those sent to help.
WHO should take steps so that others can see it and they don't repeat this stupid behavior, because these are serious issues.
For more on this story, we've invited journalist Robert Flummerfeld onto the show. He joins us now from Bukavu, South Kivu province in DRC. Welcome to DW News Africa, Robert. You worked on the story as well. You broke the story, actually. How did you discover these abuse cases?
Well, myself and a number of other journalists who had been working in the zone of the Ebola response pretty close to since the beginning, had been talking to community members about reasons for their resentment toward the Ebola response. People would describe things like militarization and corruption, but a common refrain that a lot of people heard was that, oh, you know, the responders would come in with all their money and they treat us all like prostitutes. You know, they come in and they just want us for sex and things like this. And so when I began working with the New Humanitarian and Thomson Reuters Foundation and a team of journalists like Anchka Songo, Sifa Bahati, Sam Mednick, we worked worked with trusted local civil society sources and researchers to begin a sort of trust-building process with a number of individual victims. And indeed, individual victims were apprehensive for quite a long period about talking to us, understandably so. But after we talked to the first people who described being victimized in this way, the women would say, well, actually, I know a lot of other people in my workplace who were hired like this, who had sex demanded of them before they were employed. And so thus we sort of tapped into a network of victims who had shared experiences or similar experiences and were able to build trust with them like this.
And what did you find in your investigation?
Well, we found really, across the two investigations that we published, we spoke to more than 70 women, approximately 75 women, who described really horrific forms of sexual exploitation and abuse. Widespread practice, especially in WHO and other UN agencies like UNICEF and IOM, of demanding sex in exchange for jobs, a number of instances of women describing being raped, a number of instances of women describing contracting venereal diseases, being impregnated, one particularly horrific instance of a woman dying after a dangerous botched abortion, a number of instances of women being forced to seek abortions from the individuals who impregnated them, and overwhelmingly these individuals being people working with the World Health Organization, a number of other agencies, a lot of foreigners and so forth, but people working in the Ebola response, yeah.
Right. Just going into these cases, let's look first at, for example, there were cases alleging rape. Why didn't these women take these up, as legal or criminal cases?
Well, in particular with respect to rape, it's a particularly horrific dynamic, but for instance, one of the women that we spoke to was raped, and after she was raped, she still hoped that she would be employed by WHO, and indeed she was. And so that sort of economic desperation was certainly always the dynamic. There's additionally the issue of the fact that, just generally speaking, the sort of legal system in Congo is not especially effective, and in particular with respect to sexual violence, sort of particularly egregious. And finally, and most importantly, women were very apprehensive about going public because of concerns about stigma from community members. In a number of cases, women hadn't even told their husbands that they had been abused like this and didn't want to start a protracted legal process, and likewise feared facing retribution or threats or something like this from the people who had abused them in the first place.
In our report that we heard earlier, there was Desange, who is struggling to look after her dead sister's 3 children. What chance do those children have of getting any compensation from the WHO worker or even from the WHO itself?
You know, unfortunately, your guess is as good as mine. What we know is what WHO has made public. After our initial investigation was published last September, there was a media storm, and WHO came forward, made the sort of standard rhetorical commitments to zero tolerance, and said it would engage in robust investigations. After that period, 8 months lapsed, and it seemed that there weren't any investigations occurring on the ground. 8 to 9 months later, in May or June, a team began conducting investigations of what was going on. It's not clear what was happening in the intervening period. And that team that is doing the work, it's not clear what their methodology is. It's not clear whether they would be, WHO would be willing to provide compensation or psychological services to victims. None of this has been made clear. There's been a total lack of transparency on WHO's end.
Okay. Journalist Robert Flemmerfeld in Bukavu, South Kivu province in the DRC. Thank you very much for explaining that to us.